Good afternoon, everyone. Thanks for joining us for our live coverage out of the state capitol today. I'm Janelle Slade. Governor Steve Bullock is addressing Montana on the reopening plan, Phase 2.
Phase 1 of our Reopening the Big Sky plan. Our quick, aggressive, and early actions to close schools, then bars and restaurants, and then enter into a stay-at-home order put us in a better position, in many ways a starkly better position than most other states, to allow us to start reopening. At the time, we had the lowest number of positive cases and hospitalizations per capita. And on April 26th, 3 weeks ago, we began the steps of a gradual and phased reopening of Montana. To this day, that still stands. Montana continues to have the lowest number of positive cases and hospitalizations per capita in the country. Since Phase 1 began on April 26th, we've seen a total of 22 new cases. We continue to meet the gating criteria laid out by the CDC of a downward trajectory of positive tests as a percentage of total tests within a 14-day period. While the virus remains contained in Montana at this time and new cases are relatively low, we must recognize that the virus is still with us and will be for the foreseeable future. We will likely see Montanans test positive for COVID-19 possibly every day for the foreseeable future. We cannot prevent all COVID-19 cases, but there are things that we can do to allow Montanans to have some sense of a normal life while still preventing major outbreaks or overwhelming our state's healthcare system. As has been the case in the situation all along the way, we still need Montanans to be in this together. Our goal together as Montanans is to mitigate the spread of this virus. First and foremost, when Montanans go to the grocery store, a brewery, a restaurant, or a gym, the preventative measures that we've asked Montanans to take seriously all along still limit the chance of getting COVID-19. Social distance by at least 6 feet everywhere you go. Where social distancing is difficult to adhere to, such as at a grocery store or a pharmacy, wear a cloth face mask. People who feel sick should stay at home. Do not go to work or out in public. Contact your medical provider and local health department for guidance on isolation and quarantine. Wash your hands often and for at least 20 seconds, especially when you go to places outside your home. Limit who you hug or other close contact, and don't be shaking hands. Clean commonly touched surfaces often. Montanans who've been engaging in these habits, and they are now fortunately becoming habits for us since the start of this pandemic, should continue to do so. And those who've not should start making a habit of it now. Wearing a cloth mask, washing your hands, disinfecting, really are all part of our new normal. If not for you, do it for others, especially the most vulnerable among us. Our personal responsibility to protect those around us remains just as important as any time throughout this pandemic. And it'll continue to for as long as the virus is with us. Just as we still ask Montanans to take this virus seriously, we continue to ramp up our ability at the state to respond to new positive cases. We're increasing the numbers of those tested at our state public health lab. Daily averages were 500 a day last week, with 3,496 tests run last week, up by about 1,200 from the week before. And that doesn't even count the private reference labs. Reference labs ran roughly 300 a day and 2,099 last week, which is up 600 from the previous week. That makes a total of 5,600 tests conducted last week, and we expect that number to continue to increase this week with sentinel testing efforts in nursing homes and assisted living facilities, testing events in tribal areas, and drive-through testing being conducted at a few sites. Testing materials have been delivered to 57 long-term care and assisted living facilities, and specimens are beginning to arrive for testing. Another 12 long-term care sites will be shipped materials on Friday, and the final sites the week thereafter. All willing to participate are expected to be completed by the end of this month. We continue to assess participation of assisted living facilities and estimate that about a little over 3/4 of those have already signaled that they're willing to participate. Community testing was completed at Fort Belknap and Blackfeet this past weekend. Testing and those results should be completed by the end of the week. Additionally, testing kits are being shipped to the Crow Nation, which will likely implement greater community testing next week. Samples from the Crow Nursing Home were tested this weekend, all were negative. Additional testing supplies are being provided to the Blackfeet tribe to support continued tribal testing efforts. Shelby and Great Falls continue to operate drive-through testing sites. And the Montana Department of Corrections has a plan in place and supplies to begin surveillance testing at all of their facilities. The state's epidemiologists recently produced a report that I spoke about a week ago with an update on contact tracing in Montana through May 1st, highlighting the work of local jurisdictions in containing the outbreak in Montana. Nearly half of Montana's cases were identified through contact tracing. In many cases, contact tracing helped to identify cases in smaller counties who likely were exposed to individuals in neighboring counties, thus reducing the potential for additional spread. Still, we work to further our ability to engage in contact tracing both at the state level and by local public health. In the coming weeks, we'll be looking at ways to add additional contact tracers to the existing workforce. Additionally, to date, 82 local and tribal public health offices have applied for funding through our CARES Act Round 1 grant funding to support their local efforts in contact tracing and helping businesses to safely reopen. We continue to ensure that our healthcare workers have the supplies that they need, both in response to COVID-19 and in treating other patients. Even at our peak of cases in March, we never had a shortage of intensive care unit beds and ventilators. And as we've been doing every single day, we continue to look for every avenue available, and with some success, in procuring personal protective equipment for healthcare workers and first responders. And getting that on the private side and from the federal government. Just yesterday, we received a shipment of 500,000 N95 masks for Montana's healthcare workers, which will be distributed based on need throughout the state. And with the disinfecting system, that Patel system that we now have in place, each of those masks will be able to be used repeated times. We've also constructed two temporary medical care facilities, one in Billings and one in Kalispell. If there ever were a time that we needed hospital space to treat COVID-19 patients, and this additional space for low acute non-COVID-19 patients. This is just an extra precaution that we've not needed at any time during this pandemic, one that we hope we'll never need, but a preparation that we already have in our tool belt. As we continue to move forward in our response to this virus, and certainly every day while I serve as governor, I'll continue to look at every available avenue to keep building our supply of protective equipment. The same goes for our testing capacity and ability to quickly find and isolate new cases. I feel confident that both the stay-at-home order and the first gradual phase of our reopening gave us the time that we needed to bolster even further our preparations and our response. We can continue to contain COVID-19 in Montana. As such, I'm announcing today that 2 weeks from now, beginning on June 1, Montana will enter into phase 2 of the Reopen the Big Sky plan. Now first, here's what will stay the same under phase 2. All vulnerable individuals should continue to adhere to stay-at-home guidance. This includes individuals over the age of 65 and those with serious underlying health conditions. Staying the same under phase 2, visitation nursing homes will continue to be suspended, except for certain compassionate care situations. I know that this is difficult. I've actually heard directly from some residents in long-term care facilities. I also know that 80% of the fatalities in Minnesota happen in long-term care facilities. I think over 70% in Pennsylvania came from long-term care facilities. So as difficult as it is, we're doing that to protect the most vulnerable. Staying the same under phase 2, employers should continue to encourage telework wherever feasible. Additionally, as in phase 1, individuals, all of us should follow the guidelines for all the phases of continuing to practice good hygiene and social distancing, as well as stay at home if feeling sick. Employers will be required to continue following guidelines laid out in phase 1 and all phases, developed in accordance with federal, state, and local regulations and guidance. This includes social distancing and protective equipment, temperature checks or symptom screening, collaborating with public health on testing, isolating and contact tracing, sanitation, and disinfection of common areas. Outdoor recreation requirements also remain the same operational status as phase 1. Now here's what will change in phase 2, beginning in 2 weeks. Avoid gathering in groups of more than 50 people in circumstances that do not readily allow for appropriate physical distancing. Groups larger than 50 should be canceled unless physical distancing can be maintained. It's recommended to continue social distancing in gatherings of any size. And if you are planning an event with more than 50 people, you should consult with your local public health office on a plan to implement adequate social distancing. Consistent with the Center for Disease Control guidelines, event cutoff threshold, it really is at the discretion of community leadership based on current circumstances in your community. And the physical distancing guidelines for groups and gatherings, they don't apply to household members. Under phase 2, effective June 1, restaurants, bars, breweries, distilleries, and casinos, they remain in the same operation status as phase 1, but with an increase to 75% of capacity. Gyms, indoor fitness classes, pools and hot tubs can operate at 75% of capacity, and only if, though, that they can adhere to strict physical distancing and they exercise frequent sanitation protocols. Bowling alleys and other places of assembly may operate with reduced capacity, and again, if they adhere to strict physical distancing guidelines. As I had said last week, I continue to target a June 1 opening for the Montana gates at Yellowstone National Park. I'm looking forward to continuing my coordination with the Yellowstone National Park Superintendent Cam Shawley and learning more about how the limited opening is going from the park's perspective. That limited opening just started yesterday in Wyoming. We expect that we'll have recommendations soon, and right now we do remain on track for a June 1 opening. We're just beginning conversations with Glacier National Park, tribal public health, and local public health around their reopening plans, and expect we'll have details on their plans to share with interested community members soon. Along with entering phase 2 weeks from now, the requirement that visitors to Montana mandatorily quarantine for 14 days will be lifted on June 1st as well. In working with our state public health and emergency response experts, we've determined that as Montana enters the summer months, there are more effective and enhanced mitigation strategies that we can engage in. Montana National Guard will continue to conduct screenings in airports and train depots and refer anyone with COVID-19 related symptoms to local public health officials. Over the span of the next 2 weeks, we'll be supporting the destination communities of Montana and ensuring that they have the capacity to prepare and respond to the inevitable increased visitation to our state that comes with being a tourist destination state. We'll establish test centers and ensure adequate supplies are available to meet resident, seasonal employee, and visitor needs within the most visited destination communities of Montana. We will coordinate a surveillance testing plan to create an early warning system for potential community spread in the most highly visited and highly vulnerable destination communities. We'll also support the development of contingency plans for managing sick visitors, including contact tracing capabilities. And this includes enhanced contact trace resources deployed to areas of need. Over these next 2 weeks, we'll also encourage the development of plans for high-use, highly trafficked areas. This includes implementing limitations on parking to manage crowds and posting appropriate public health signage, as well as finding ways for station staff and volunteers to offer public information, masks, and/or even hand sanitizer. We'll also be asking that limited closures are maintained where necessary. Furthermore, we're developing a statewide campaign for responsible travel, focused on themes such as knowing local guidelines or restrictions before you visit. If you're sick, to stay at home. And that Montana will be welcoming back visitors with initially limited services and destinations that are open for business. While our economy certainly relies on and we appreciate our visitors, we want to make sure that those visitors don't bring problems from their home state to our state. That's why we'll be making sure that Montana is prepared to handle an increase in visitors and to keep the virus mitigated as that happens. As we look at ways to safely and gradually welcome visitors back to our state, many of our tribal nations still have stay-at-home orders in place or other more restrictive measures. I ask that Montanans and any travelers into our state honor the restrictions in our tribal communities. Our tribal nations have my full support as they determine what's best to keep their communities safe and healthy. I know that there are so many businesses that are taking the guidance seriously and taking the appropriate measures to keep their employees and customers safe. But I've also heard anecdotally stories of Montanans not following the guidelines that we laid out in phase one. Montanans and businesses need to understand that these guidelines, which were developed in consultation with both public health and business representatives, are in place to protect people from COVID-19 and to allow us to move forward with the phases. Not following these guidelines is what will get us in trouble. Not following these guidelines could very well put us in a position where we would have to go backwards instead of being able to continue to move forward. Montana truly has been an example for the rest of the nation in our response to this global pandemic. I have no doubt that we can continue to be that example, but only if Montanans, businesses, and visitors alike continue to take seriously the responsibility we all have in protecting others. Especially as we increase the size of crowd gatherings, we still must be cautious of engaging with new groups of people and limiting outings to the brewery, bar, or restaurant, and always engaging in hygiene measures. I know that no one wants to find out that they were the ones who spread the virus to others. This is preventable by continuing to take COVID-19 and this virus seriously. So let's continue our work together as we create yet another new normal. Thanks so much. I'll now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question.
First phone question.
First phone question.
Hi, Governor Bullock. This is Marisa Giorgio from NBC, Montana. I'm wondering, email addresses are being included in contact tracing in places like Washington. Is that something you'll consider as you lift that mandatory quarantine period for visitors as a way to contact trace people who might be coming to our tourism hotspots?
So, Marisa, I'm not sure what all Washington State is doing, but what we have been doing throughout with contact tracing is anytime that we do find a positive or a suspected positive, local public health directly contacts and reaches out to that individual and surveys and surveils those individuals that the COVID-19 positive person had contact with over the last 2 weeks. So we'll work every way to make that most efficient. I'll certainly take a look at what Washington State is doing in gathering emails, but as I noted earlier, local public health, about half of the cases that we've even had in Montana have been identified by the good work that they've done in contact tracing. Recognize that every single time that that occurs, it's preventing the possibility of that one individual being the start of another cluster.
Another phone question.
Phone question.
Hi, Governor. This is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this call today. Your office has said that counties cannot loosen the requirements issued by the state, but they can be more restrictive. I'm wondering if that's still true, kind of thinking that phase 2 of the plan says groups larger than 50 can't happen if people can't maintain social distancing, but you also just said that anyone who's planning an event for more than 50 people should consult with local public health office, and maybe they can make an exemption. So can you just kind of clear this up? I think there are some exemptions for looser requirements at the local level, and I'm just curious how that's who's in charge of making that call, and how does that square with what you are saying from your office?
Sure, Nikki, and thanks for the question, because at times like this 10 and this 50 can seem confusing. In phase one, what we said is where social distancing isn't possible or practicable, up to 10 people can be together. In phase two, what we're saying is where social distancing is not possible or practicable, even though we should all still try to do it, up to 50 individuals could be together. So that's a limit on a grouping where there's no social distancing possible. That's not a grouping on the aggregate number of folks that could gather if social distancing occurs. Again, many places around the state, there's certainly going to be some high school graduations occurring, which will have more than 50. But I know that those schools have been working with their local public health officials to turn around and say, how do we safely have social distancing and have the opportunities for crowds larger? So it still remains the case, certainly, that local public health can't make less restrictive guidelines than what the state directives are. But the encouragement is for folks that are going to hold an event to actually work with local public health and say, all right, I'm going to have an event that could have 100 attendees. How could I do that safely? And what that would require is physical distancing and taking other precautions along the way. Does that answer your question, Nikki? Does that clear it up for you? If you can unmute her, still find her.
She's unmuted.
You're unmuted, Nikki. Any follow-up, or do you understand the distinction there?
Yeah, so it sounds like you're just encouraging folks to work with their county public health. I guess it kind of raises this question of who's running the show, and how strict are your guidelines, and are they requirements? And
Well, yeah, certainly they do still remain requirements. But if an event is happening in Yellowstone County, it makes much more sense to be talking to local public health officials who will be monitoring that as far as how to pull off that event consistent with the phase 2 guidelines. Additional questions?
yeah, thanks very much.
You got it.
Next phone question.
Next phone question.
Hi, Governor Bullock. This is Jonathan Benzer from Montana Free Press. I was just wondering, who's in charge of the surveillance testing in the gateway communities? And just one other quick question is, ag auctions have been trying to figure out how to proceed with large crowds and things like that. I just wondered if you had any guidance for auctions, especially related to agriculture.
So the first question is, in the gateway communities, who's in charge of surveillance testing? And look, that's where both at the state level, then we're working with local public health. So, for example, in those communities in Park and Gallatin counties near the gateway, we've had regular conversations with public health officers and then individuals in those counties. So at the end of the day, is local public health running these. We're providing resources, and then we're also providing assistance as needed. On the second question, guidance for ag auctions, any event that's going to have more than 50 people need to figure out the ways to adhere to social distancing. And that's where, again, I would encourage then someone that is going to be having an event to work with other local public health officials to make sure that that can be done.
Question from the press.
From where? Oh, Jonathan.
Governor, this is Jonathan Ambarian from Montana Television Network. I wanted to ask, in the original plan that we saw, the 14-day quarantine was expected to continue through into phase 2. What was the decision-making process in moving that portion of it up to earlier?
Yeah. I think it's several-fold as we look at it. Part of it is, as I noted last week, as we open up Yellowstone gates, it's that much more likely other individuals will actually be coming from out of state through those gates. Part of it is the practical realities. I took a run near Holland Lake this past Sunday, and seeing a number of out-of-state cars, so folks are coming in. Part of it is what we've collectively been able to do together in making sure that we don't have sufficient or significant caseloads each and every day. And then the rest of it is actually then providing even the time before that to work with those impacted communities to say how do we best mitigate and contain the risks.
Thank you.
Hi, Governor Bullock, Beyond Broxton, NBC, Montana. With Yellowstone, they have 3 gates that are closed right now. Have you talked to the superintendent about possibly opening those gates one by one, since 70% of the majority coming through those gates?
Well, and that's what we want to see, Leon, because as the superintendent even said, like they first opened the gates literally yesterday in Wyoming. And he believed, and I share that belief, that it makes sense to see how things are going for a couple of weeks before we even talked about opening up on the Montana side. So I think that I'll be in regular conversation with the superintendent of Yellowstone Park, as I have all throughout this. We'll see how it's going in with 2 gates open as we make the decision on the Montana gates. Now I anticipate that to be a June 1, 2 weeks from yesterday, but it's also, as how many times have I said that this is a dynamic time? We want to make sure that the park can both handle it and our gateway communities are prepared.
Governor Jeremy Schnell, ABC Fox. What kind of aid are you going to be providing to landlords and renters as the directives for renters to not have to pay rent expires next week?
So what aid will we provide to landlords?
Or resources?
Well, there already is. I mean, we have in place through the business stabilization grants programs, if a landlord or a renter wasn't getting rent, that they could actually get relief through those programs.
Okay, and as the directives expire next week, is there anything that is going to move forward with that, or is it just going to expire?
The directives, it still stays in place for vulnerable populations that have also been economically impacted by COVID, so someone over 65 or that has health conditions. There's still then availability for rental relief or payments from the state program that we stood up with the CARES dollars.
Another phone question.
Another phone question.
Hey, Governor. Tristan Scott from the Flathead Beacon. Thanks for the opportunity. I'm wondering, can you describe in more detail the strategy for surveillance testing as the state moves into phase 2, and particularly as the quarantine is lifted for out-of-state visitors? What types of communities will have the most testing resources? And second question, as we ramp up that type of surveillance testing and begin allowing out-of-state visitors into Montana without a quarantine, should Montanans be surprised if we start to see an uptick in positive cases?
Yeah. So the first question, and Tristan, we'll provide more information about this over the next 2 weeks as far as what it looks like in enhanced surveillance testing in communities. I mean, what we've been working with already in West Yellowstone and Gardner, for an example, is everything from making sure that the frontline workers have the opportunity to be regularly tested, if they so choose. Making sure that there are resources for visitors to Montana to be tested. Ensuring that if we do have an outbreak, that there are areas where we could put those visitors in isolation and quarantine. And just encouraging overall enhanced testing in those communities, because the sooner, like more or less step on a spark, if you will, the more likely it'll go from becoming a flame. And your second question was, as we allow others in, do I anticipate more positives? And I think that, look, every step that we take beyond a stay-at-home order and closing down all businesses indeed presents risk of more transmission. And I certainly expect out-of-state visitors to take this seriously as Montanans have. Adhere to both the guidance that I put out and the expectations of what we need to be doing in this community. I know that every time that you lift a restriction, even going into phase one, you're creating the possibility for further transmission of the disease. So what we need to be doing is everything we can, both the initial identification, the possibility of that disease, but also having the contact tracing and the resources in place to ensure that where we do have positives, we can mitigate that spread.
Phone question.
Another phone question.
Hi, Governor Bullock. This is Bradley Warren from ABC Fox Montana in Bozeman. I just wanted to ask a clerical question. What exactly does this mean for small studio fitness gyms, like cycling studios, yoga studios?
So the question, what's it mean for small fitness studio gyms like a cycling studio? They should work with local public health. That the max capacity is 75%, but that's only where social distancing is possible. So if it's a real small space and you could only fit, 3 cycles in with 6 feet apart between them, or social distancing, it'd be 3 cycles. So we are resuming for indoor classes, but only where social distancing is practicable.
Another phone question.
Another phone question.
Hey, Governor, this is Holly. How are you?
Good, Holly.
So my question might be a little bit duplicating Tristan's, but just wanted to clarify, in terms of those destination communities, can you say which communities in Montana those are? And then do you have capacity now to do the testing that you'd like to see done there? Or do you anticipate us getting to that capacity by June 1st or shortly after?
Holly, so we're actually then working with local communities, and that's everywhere from a Whitefish, which we've reached out. We've already been reaching out to these communities in advance, and that's what the next 2 weeks of this is, also to make sure we're having discussions with them about what sort of supports that they may need along the way, and we'll work over the next 2 weeks to provide those supports. Department of Commerce does an incredible job of, literally mapping where people come and from where they come, so we can use both the data-informed decisions and working along the way. To the question of, do I believe that there will be enough testing in those areas within the next 2 weeks so we're ready on June 1st? Yes, I do.
Is it safe to say that phase 3, everything will be back to normal, or is this too soon to say?
Yeah. We're still 2 weeks from getting to phase 2, and we have to see where that goes. Look, first of all, until a vaccine is in place, the idea of getting back to normal is always going to look differently, right? And from my perspective, like tourism, even under phase 2, isn't returning to normal, because we're putting expectations on businesses and visitors alike. So we'll have to see how phase 2 goes before we can have any discussion about further steps. We've gone from phase 1 to phase 2 about a 5-week period. Now that shouldn't suggest then that in 5 weeks from now we'll be talking about going to phase 3, because we're also, as noted, lifting the mandatory requirement for 14 days of quarantine for those that travel from out of state. So as always, we're working with both the health professionals and the businesses. And it is so critical that the businesses take great responsibility in trying to take these guys well. Who are you? Okay. These are your knees. Sit down first.
No more questions.
No more questions. That worked out well. Do any of you have questions? Well, great. Thank you again. And I really encourage all Montanans. Now that I recognize this is still 2 weeks from now before we get to this next phase. But again, really do encourage Montanans to recognize that what we've been able to do, the gains that we've had, even when COVID-19 is still in our state, in our nation, the gains that we've had are because we took this seriously. There's a reason why that we have literally the lowest positive tests and hospitalizations per capita in the nation. And it's because of what we as Montanans all did together. And I ask you to continue that same degree of vigilance as we reopen other areas. Because it really is on all of us and all of us working together that will make it so that we can keep both the low numbers and the opportunities we're having. So thank you so very much.
Governor Steve Bullock addressing Montana live from the state capitol today, now announcing that 2 weeks from yesterday, on Monday, June 1st, Montana will enter into phase 2 of reopening. Now, this means that Montanans must still continue to follow guidelines. They must continue to keep good hygiene and social distancing. What will change, the governor just said, is group sizes will move from a maximum of 10 to 50. Now, within that 50 people you gather together, you still have to have 6 feet of social distancing. So those rules are still in play here. If you like larger groups than 50 people, then you need to check with your local health authorities. Also, in phase 2, bars, taverns, casinos, restaurants can increase to 75% capacity, with also frequent disinfecting and following rules. He also reiterated that on June 1st, Yellowstone National Park, the gates here in Montana, are expected to open on June 1st. And the mandated quarantine, a lot of people wondering about this. If you're coming into Montana or if you leave Montana and you come back, that mandated quarantine of 14 days will be lifted on June 1st. Thanks for joining us. Tune into your local MTN station this evening for the very latest on the governor's plans and your local news. Have a great day, everyone.